this opportunity to provide to the public of St. Kitts and Nevis a clarification, or I should say further clarification, on the pending visit by the U.S. Navy ship Comfort during the period October 5th to 10th, 2019. This ship's visit is made possible by the U.S. government through its embassy in Barbados and is seen as a gesture of goodwill on their part. And of course, it is being led by the U.S.'s Southern Command. Several months ago, we became aware of this intended visit by the U.S. ship Comfort, which was intended and still is intended to offer free of charge medical services to the people of St. Kitts and Nevis who may so wish to access these services. 2 press releases would have been issued by the Office of the Chief Medical Officer on this pending visit, the first of which would have been issued on August 26th, and then the second on September 6th. And that statement on September 6th was also done as a national broadcast by the Chief Medical Officer herself. As such, my statement today is to, 1, reaffirm what would have already been communicated by the ministry via the Office of the CMO, and the second one is to provide clarity, further clarity, on what this visit is intended to do. The visit is being held under the auspices of the Southern Command's Enduring Promise Initiative, and it is meant to be 2-pronged. The first part is a land-based medical mission, while the second part is a ship-based surgical mission for those persons who meet established criteria for surgical interventions. And I will explain both in detail. The medical mission involves the provision of health care at the 2 following land-based sites in St. Kitts only. 1, the Antioch Baptist Church, Limekiln, on the grounds of that new facility, and second would be the St. Paul's Community Center, St. Kitts. The medical portion of the mission will focus on preventive care, basic medical evaluation, dental screenings, and optometry screenings and treatment. Persons from both St. Kitts and Nevis are invited to access care at any of these 2 medical sites from October 5th to October 10th during the hours of 9 a.m. to 3 p.m. daily. The ship will not be docked in Nevis at any point during this mission. Some of our local nurses, both at the community-based and institution-based sectors, will be present and on hand to assist with these evaluations and screenings at the Antioch Baptist Church and St. Paul's Community Center, as stated earlier. Now, the second part of the mission, as I said, is a surgical mission, and this involves the provision of surgical interventions and care on board the ship to persons who have been diagnosed with a medical problem that requires surgery. These persons must be referred to the hospital ship by either their attending local physician or a district medical officer based at the nearest health center. The public should be advised that the district medical officer or one's regular primary care physician will then confirm the suitability for surgical referral to the ship's hospital. The surgical patient's regular physician, or the DMO in that case, will be required to complete the relevant documentation and submit the name and completed document to Dr. Keisha Liddy, Director of Community Health Services on St. Kitts, who is the focal point over here, or to Dr. Judy Nisbet, Medical Officer of Health, who is the focal point in Nevis. I should also state that in a memo dated the 25th of August, the Chief Medical Officer would have written to the entire medical fraternity, both in the private and public sector, indicating the background information to the visit, the modalities for accessing treatment, and the list of surgical procedures that are available to be accessed by persons who so qualify. Each surgical candidate whose name would have been submitted to his or her doctor, along with an adult next of kin or patient escort, will be required to attend a pre-surgical screening clinic to determine the eligibility for surgery. This pre-surgical screening and eligibility clinic is scheduled for Thursday, October 4th at the Antioch Baptist Church grounds, Limekiln, from 8 a.m. to 4 p.m. Mr. Speaker, I would wish to use this opportunity to make it abundantly clear that it is the responsibility of all surgical patients and their DMOs or the attending physicians to seriously consider how their care after surgery should be managed once A, they would have been discharged from the ship, and B, more importantly, once the ship leaves the Federation at the end of the mission. The Ministry of Health, however, wants to reassure the public that in the event that there are health complications arising from surgery on board the ship, our institution-based health services will render the best care possible in the hospital setting, as it is the government's mandate to never deny care to anyone. To facilitate such health care once the ship would have left, the Ministry of Health will maintain the medical and surgical files of all patients who would have accessed care on board the ship. I should also state, Mr. Speaker, that at this time, most of the surgical procedures that are being offered by the U.S. Navy ship Comfort are routinely practiced right here in the Federation. And to the best of our knowledge, there is not a situation at present where there is a long waiting list for persons who are awaiting such surgeries to be performed. The cadre of surgeries being offered on board the ship include the following general headings: orthopedic surgeries, those related to bone injuries, etc., general surgery, just as the name suggests, appendectomies, tonsillectomies, hernia repair, etc., ophthalmology, which is the eye surgery, plastic surgery, or referred to as cosmetic surgery, and urology surgery, which relates to those of the urinary tract, including but not limited to the kidneys, ureter, and urethra. It should also be noted that 2 of our local medical practitioners who are operating at the senior level will be on board the ship at all times during the surgical interventions to ensure that the standards are being kept. It should also be stated that the credentials of all foreign medical personnel who will be conducting the land-based medical screenings and the surgical interventions on board the floating hospital are currently being processed by the local medical board, who would have to provide temporary licenses in keeping with the Medical Act. Mr. Speaker, it is also no secret that for the past several months, there has been a considerable amount of negative publicity and conjecture surrounding the pending visit of the U.S. Navy ship Comfort. Many of these uncomplimentary social media postings via WhatsApp, etc., have been done as audiovisual clips. I wish to assure citizens and residents that the federal government will never expose our people to questionable medical practices, particularly those of an invasive nature that can bring harm to our people. As a result, every precaution, every applicable medical regulation, and standard operating procedure has been taken by the Federal Ministry of Health and the Office of the CMO in an effort to protect persons in accessing the health care on the floating hospital. Moreover, we wish to remind all concerned that the decision to access health care on board the ship or via its land-based screenings at Antioch or in St. Paul's is a matter of personal choice. Persons are free to choose whether they wish to access health care provided by the medical personnel who are assigned to the ship, or if they will not access such care. The U.S. Embassy, I should also state, Mr. Speaker, is quite aware of the negative publicity surrounding the imminent visit of the U.S. Navy ship Comfort, and has since the 29th of July issued a statement on the matter. This statement is available on the U.S. Embassy's website out of Barbados. In closing, Mr. Speaker, I wish to use this platform to encourage each and every one of our citizens and residents to actively police his or her health, to have regular medical checkups, and to participate in regular health screenings. Our nation's formidable challenges by non-communicable diseases, NCDs, make it all the more necessary for each and every one of us to safeguard our health. Whether we access care via a private physician, through our public health system, or through goodwill medical missions such as that being provided by the U.S. Navy ship Comfort, is entirely up to personal choice and preference. What is important is that there is no substitute for routine medical consultations in an effort to safeguard our health, improve awareness of underlying medical problems, and to be able to get corrective medical interventions in order to sustain our health and improve our quality of life. The U.S. Navy ship Comfort is staging these medical missions to some 10 other countries within CARICOM and Latin America. They are Grenada during the period September 15 to 20th, St. Lucia during the period September 25th to 30th, and also to Colombia, the Dominican Republic, Trinidad and Tobago, Haiti, Jamaica, Costa Rica, Ecuador, and Panama. This current rotation makes 7 hospital ship deployments in the region by the U.S. Navy since the year 2007. I also wish to say to the public in closing that in spite of the 2 releases that would have been aired on August 26th and September 6th, and now this morning's statement by ministers, if there are members of the public who still have questions or concerns, we encourage them to call the Ministry of Health, and we will be happy to provide them with additional information. May it please you, Mr. Speaker.